the CU team, and then I'm going to ask Sam to have the opportunity to do the same for the city on the call. So let me begin by introducing Patrick O'Rourke. Pat is the interim Executive Vice Chancellor and Chief Operating Officer. And I believe that many of you met Pat virtually on the July 14th study session. Russ Moore, that many of you know, who is our Executive Vice Chancellor and Provost. Our Vice Chancellor for Student Affairs, Akira Bradley. And our new Dean of Students, who just joined us a few weeks ago, JB Austin Banks. And it's a pleasure to have JB with us. Earlier, of course, you met Francis, who is the Senior Strategic Advisor for Government and Community Engagement. Derek Silva, who's our Assistant Vice Chancellor for Business Strategy. Dan Jones is with us, our Associate Vice Chancellor for Integrity, Safety, and Compliance. And Doreen Jokrist, our CUPD Chief of Police. Daniel Easton is with us. Daniel is the Acting Director of Student Conduct and Conflict Resolution. And Jeff Moores, who is the Director of our Office of Off-Campus Housing and Neighborhood Relations. And finally, Kim Calomino, who is Director of Local Government and Community Relations. So I want to welcome the CU team, and Sam, would you like to introduce the city participants?
And I don't know if Sam's joined us, so I don't know if Jane or someone else wants to do that.
Yeah, I'm happy to do it. I think that both Sam and Bob may be in a different meeting. So I apologize to my council members because I'm not going to do this by introducing you first. I'm actually going to go down the participant lists to make sure that I hit everyone. So I apologize. First, we have Aaron Brockett. Aaron is a city council member. Hi, Aaron. Adam Swetlick. Adam is a city council member as well. Carl Castillo. Carl is the senior policy advisor for the city, and he works in the city manager's office. Chris Meschuk is our deputy city manager. Let's see. I don't want to miss anybody. Junie Joseph. Hey, Junie is our council member and a proud CU student. Linda Cook, our municipal judge. Chief Maris Harold, who is our new police chief. Mark Wallach, city council member. Mary Young, city council member. Phil Kleisler. Phil is a member of our long range planning team. Rachel Friend, and Rachel is a city council member. Sarah Huntley is our communication director, and Tom Carr, city attorney. Thanks.
Well, thank you, Jane. So today we have updates on the university's plan for the fall semester, on flood mitigation at CU Boulder South, and on the conference center. And first, I'd like to ask Pat O'Rourke and Russ Moore to give you a quick update on the plan to return to campus, where we are with testing, and then safety measures overall, and how we're addressing education on the campus. So Pat and Russ, I'll turn it over to you.
Let me do some screen sharing for them for a presentation, if everybody can bear with me 1 minute. And can you see that screen? Great.
I can. So, hi everybody. Thanks for inviting me back. Last time it was just me and Francis. This time I thought we should bring a small CU Army. So that's why we've got everybody with us today, and hopefully between the group of us, we'll be able to answer your questions and provide some good information about how we're progressing towards the fall. But there's been some development since the last time we got together. And Francis, could you pop up the first slide? The first thing that I wanted to share with you is that we had talked to you about the technology that some of our researchers were developing. And what they've come up with is a really exciting saliva-based test that is the RT LAMP test. Please don't ask me to explain what the acronyms stand for because it's kind of sciencey and I barely made it through high school biology, but I can tell you what the test does, which is it's a saliva-based test that we would be able to produce the test kits for, be able to administer, and receive the results back in as little as 45 minutes. That's been important because, as you've seen throughout the state, there's been a shortage of testing capacity, and sometimes, in particular with the commercial labs, that it's been taking more than 3, 4, sometimes 5 to 7 days for them to be able to return results. So that and some of the other capacity that we've developed to perform testing will allow us to be able to more effectively be able to perform that function. That new test that we've developed is something that we are in the process of having it approved. Ordinarily, there's an FDA approval process for the ability to be able to have testing approved, particularly if it's going to be for diagnostic purposes. But there's an allowance under the law currently that allows the state through the governor's office to be able to approve and validate novel testing ideas. That is something that we're in the final stages of validation with the state. We could currently use that new RT lamp test as a surveillance tool, but hopefully if that validation occurs over the next days or week, we should be able to not only use it as a surveillance measure, but also as a diagnostic test. Third, I'm really proud to announce that our communications staff has been working hard in order to be able to launch what we're calling the Protect Our Herd website and campaign. This is really based on the notion that we talked about the last time that we came and spoke with you about the fact that we can develop technological capabilities, we can put in contact tracing, but that fundamentally we're going to need to change behaviors and to be able to influence behaviors, not only of our students, but our faculty and our staff and everyone who comes in campus and is part of our community. And the Protect Our Herd campaign is really designed to raise awareness and reinforce positive health and safety behaviors, such as social distancing, masking, sanity, all of those, not sanity, sanitation, to be able to make sure that we're building the right behaviors on campus and that there is collaborative messaging going on with the Chamber of Commerce, with the city, with the county, and with a lot of members of our community. We've also launched a series of safety trainings. Before faculty, students, and staff come back to campus, all of them will have to complete COVID-ready training. Many university faculty and staff have already completed this training, and we launched it recently for our students. For the students, we've got it set up so that they would be unable to complete their registrations unless they have come through and completed the safety training. And then we're also really excited to be able to talk to you about the Student and Community Ambassador Program. This was actually something that got a kickstart out of the last meeting that we had with you when we talked about the need to have students who are involved in the effort to be able to promote safe behaviors in the community. That's been a collaboration that's been moving forward with Downtown Boulder, the Convention and Visitors Bureau, and the city itself. And we're really grateful for the way that people have reached out and collaborated in order to make this something that we can work on together for the safety of the community. Francis, could you pop forward? So the next thing that I wanted to talk to you about is the testing, contact tracing capabilities, and other things that we're doing in order to be able to promote a safe return. And when we last spoke, I told you that we'd be using multiple testing modalities. That remains true, but we've continued to evolve our testing strategies, and I wanted to bring you most up to date. In order to do that, I'm going to have to get a little bit wonky and talk to you about the different type of tests that we are going to be administering, how we're going to be using them, and the strategies that we're employing. So in talking about the different types of tests, the first type of tests that we're going to be using are PCR tests. These are the ones that you're probably most familiar with from having seen them over the last several months. Those are the tests that are generally administered with a nasal swab, and that they are there to really being used most with the symptomatic population. They can be used to detect COVID in an asymptomatic patient, but that because of the scarcity of testing in the state and the community, that's the one that's been used most often and normally only with symptomatic patients. That's where the state's been seeing the test shortages and also some significant delays in returning results. What we're happy to be able to say is that we have invested in our own ability to be able to do PCR testing on campus through the Wardenburg facility. The reason that that's important is that that will allow us to run results more quickly than what's currently happening through the commercial laboratories. And up until recently, we didn't have that capability, and we were planning on sending things out to a commercial lab. But with this capacity that we've developed on campus, we're first going to be able to minimize the diagnostic testing burden in the broader community, such as the city, the county, and even the broader metropolitan area. The other thing that it's really important is that it's going to enable us to ensure that we're providing a consistent and predictable turnaround time for the tests once they've been administered. And we should be able to return the PCR results in approximately 24 hours or so. So that's an important capability that we built in. The second thing that we're going to be able to employ as part of our testing strategy is the RT LAMPS test that I talked to you about a minute ago. And when we last spoke, our researchers were still developing this test, which is a saliva-based test, returns results in just about an hour. Now, the RT LAMP test is slightly less sensitive than the PCR test, and it's something that we're using in the first instance as part of a surveillance strategy. We'll be able to manufacture those test kits on campus, and if a RT LAMP test reveals a positive result, what that really allows us to do is be able to take that information that we've received quickly and then run a confirmatory PCR test. But the real value of this is that it allows us to be able to receive a quick result, put contact tracing and other protective measures into effect as rapidly as possible, and then be able to follow up with diagnostic testing. As I talked about, that test is going through the process of being validated so that it could be used for diagnostic purposes. And so that would then also be something we could add into as an additional quiver in our batch as we're moving into the diagnostic phase. Third, and this is an area that I'm also really excited about, is that we've developed the ability to do pooled saliva-based PCR testing. One of the things that we know is that COVID is something that you will have some degree of symptomatic patients, but you're also going to have asymptomatic patients. And what we're really looking to be able to do with the pooled test is a surveillance strategy to try to find pockets of infection, either when those people are asymptomatic or with a pooled test, we'd be able to take a batch, whether it's 9, 10, 12 people, and run them as a single group. We plan to be able to run up to 700 or 800 of those a week. And then once we get those results back, if one of those batches shows a positive result, then you can go back and do diagnostic testing amongst the group of people who were part of that group. The pooled testing really expands our capabilities to be able to follow up on this. And why that's increasingly important is that we're finding that the population of asymptomatic or pre-symptomatic people are the ones that have a lot of potential to be able to spread within a community. People who are symptomatic generally know that they want to isolate, that they want to quarantine. And this is giving us the ability to reach out more effectively to try to find those cases that even the people themselves know they don't have. Fourth, we're going to be doing wastewater testing in about 20 of our facilities on campus. COVID-19 is detectable in wastewater, and the testing itself has a fairly high degree of sensitivity. If the wastewater demonstrates the presence of COVID-19, that would send a signal to us that we need to test the occupants of that facility, and that hopefully we'd be able to find the person who or persons who have COVID infection that they might not even know about again, because It actually turns out, and I was interested to find out, that COVID will show up in wastewater oftentimes before it would show up anywhere else. And that would give us a good first early indicator, both of the presence of our disease in the community and give us an added ability to be able to go in and be able to find it before it could spread to others. And then finally, we're going to be doing PCR testing upon people who are displaying COVID-19 symptoms. And so that is really the strategy where you've got people who are coming in, they've got a fever, they've got a cough, they've got something that leads you to believe that there's COVID infection, and we'll be able to respond in those cases as well. I think the thing that's important to remember there is that that testing is important and it's confirmatory, but it's really something that we're using as an adjunct to our other testing strategies, in contrast to what you're seeing in the broader community a lot of times, where testing is being reserved for those people who are symptomatic. We're really trying to get ahead of the curve on being able to find the disease before people know they have it. Some of you have had questions about antibody testing, and that really isn't a part of our testing strategy at this point in time. The reason is that it doesn't allow you to detect active COVID cases, but will only provide you with an indicator of who's previously been infected. If people with antibodies developed a sustained immunity, then antibody testing might be a better population-based testing strategy to allow us to know how many people have recovered. But the latest research is showing us that inconclusive results as to whether or not that those antibodies provide sustained immunity. And so we're really trying to rely on what's going to give us the most effective information prospectively rather than a retrospective look. So overall, the biggest changes in our testing strategy since we last spoke are our ability to do both diagnostic PCR testing on campus and the ability to use the RT lamp testing as part of our strategy. What really that allows us to do is to have the ability to bring testing to where it's needed, to receive rapid results and have the ability to keep our campus and our community safe. So those are the methods that we're using for testing. And then there's some questions about how we're going to go about administering those. And so as we think about that, I first want to draw a distinction between those students who we're requiring to be tested and those students and other members of our community to whom we're going to offer testing and be able to make it available as part of our surveillance strategies. During move-in, we're going to require students to either produce a recent COVID test or require testing of them before they move into campus housing. That's a defined population where we have a defined access point to be able to reach out to them. And we're also going to be working with some of our other student populations. For example, we'll be able to require testing for our student athletes. And we are going to be able to offer testing to students who are off campus, faculty and staff, even in those instances where we're not requiring it for them. There's thousands of students who are already living in the Boulder community along with our faculty and staff. They're part of our surveillance strategies throughout the course of the semester. And as we increase our testing capabilities with the RT lamp rapid test that we're building right now and having validated, that's going to be an increasing part of our testing strategy, not just for those incoming on-campus students, but for off-campus students and our faculty, students, and staff across the entire community. Finally, as you think about our testing strategies, it's important to remember what our testing capacity can do and what it can't. It can't be and it won't be a mechanism by which we will eliminate all COVID infections. We don't want to make promises that we can't keep, and we know that there's going to be instances where there's going to be COVID infections in our community as well as in the broader Boulder community, just as there are now. What our testing is really allowing us to do is to be able to respond to those cases by instituting contact tracing and to be able to reach both the infected and potentially infected to mitigate the possibility of further transmission. We're really proud of what we've done to be able to create those capabilities. Our testing capacity is greater than what the state is providing. It's greater than what's generally available in the community. And we've shared our testing strategies with Boulder County Public Health. They've been supportive of our testing capacity and our plans for surveillance testing. We've worked with Boulder County Public Health to have a memorandum of understanding that be put in place to allow us to coordinate our contact tracing with the county, and they consider us a closed system and have given us the legal authorization to be able to do that. We have been and will be closely partnered with the county throughout the fall, and we're going to work collaboratively to test, trace, and isolate affected individuals in an effort to both protect the campus and to protect the community at large. And so testing is important. It's going to allow us to be able to respond. Our primary goal is still going to be prevent infection. Social distancing and masking are the strategies that we're going to employ for prevention, and we've been aligned with all the state and county orders as we've been moving forward. So with that, I think that's what I wanted to address with you on the testing front. And Francis, if you could pop the slide forward, I think Russ could jump to the next question, which is, why is it that we are planning on returning people to campus in the fall rather than trying to conduct the semester fully remotely?
Right, and I just want to jump in for a second and say, if I could ask everyone to mute, we've got some background noise going on. And we've just got a couple more slides, and then we thought we'd open it up to questions after that.
Yeah, thank you, Pat. And thanks everyone for being here today. So let me address as briefly as possible, why not be fully remote? The reasons are several fold. First of all, Pat alluded to the fact that Boulder County Public Health considers us to be basically a closed system. What that means is our campus community is actually an ecosystem within the Boulder community. We also know from data done from a number of formal studies, not the least of which coming from Cornell, is that most of our students and campus affiliates will interact with each other. So one of the things, or several things that Pat alluded to, that would be our testing capacity, our testing strategies, and our ability to do contact tracing allows us to have a very robust ability to not only execute our prevention methodologies, but also to detect and isolate infections when they do occur on campus and elsewhere in our community. One of the reasons why we've chosen to bring people back to campus is it's part of the university's mission. And part of the university's mission is to engage with our students and to teach them to be good citizens moving forward. Many of our students are already here. They've been here since the close of the last semester. In fact, some estimates are up to 10,000 of our students who live with you today. So bringing students back and engaging them in more formalized activities and allowing us to use these detection and isolation methodologies with them would arguably allow us to make that portion of our community safer than the general norm. Another issue is that not coming back or doing remote only education disproportionately disadvantages underserved populations. So those would be from lower socioeconomic groups and students of color, et cetera, et cetera. So what we want to do is be able to allow us to deliver our mission to all of our students on campus, particularly those who are most in need of the delivery of our mission to them. We also are a research university, so that's key to keeping our operations moving. So one of the things I would make a plea to council and the greater community is that we are part of the Boulder community. We take that responsibility and privilege very, very seriously. And we would hope that you would work with us to welcome our students back to campus. And I acknowledge that students are in that younger demographic. So whether they're students or not, if people are young, they tend to engage in perhaps less responsible behaviors, but we believe that the processes that we have in place will allow us to mitigate the risk of transmission of COVID virus into our community. And again, the students are not the enemy. Students are part of us. And I think by working together with student peers and with faculty and staff and community members, we can impose upon our students and the other members of our community the importance of, first and foremost, participating in social distancing and masking protocols. I think that is the best option that we have moving forward. Once again, the students are here, and even if we were to go fully remote, we know that because of many housing contracts, et cetera, that many students will end up showing up in Boulder anyway. So if that is going to occur, then I think doing so under a more structured paradigm, such as the one that Pat just described and the ones that we're using here on campus, I think is better to protect both the campus community and the Boulder community writ large. So with that, I think Pat did a wonderful job of talking about that. So let me kick this back over to Pat, and then maybe we can get to the Q&A section.
So the challenge in these things is that you mute yourself, and then when it's time for your turn to talk, you can never find the unmute yourself button. So sorry for the awkward delay. We had just a couple other things we wanted to run through with you because it responds to some questions that you've given us and some questions that we've heard from our own constituents. And that's really, how are you going to decide how to move between different statuses throughout the course of the semester? And what are the things that you're monitoring, and how is it that you're going to go about making decisions? And the first thing I want to do is really talk to you about different modes of operation. For the purposes of our conversation, I'm going to place them into kind of three great big broad groups. First is normal. And as everybody knows, because we've been working with this experience over the past 5 months, we're not in a normal state right now. Normal is what I would describe as being in a pre-COVID state. For those of us in the CU community, that would be where we've resumed all in-person operations and we don't have any restrictions on events and other activities. And right now, it's very difficult to see that we would be in that normal status during this academic year. We know we're not going to be in that status during the fall. And in fact, we are planning on returning all the students to their communities of origin around the Thanksgiving time so that we're not dealing with people traveling back and forth between their communities over that holiday period. The second state is the one that is where we're fully remote. And that's the state that we experienced in March 2020 when we ceased in-campus operations, and with the exception of some limited critical services, such as that we always had a contingency of people for housing and dining. We at all times had students through the course of the spring semester who were unable to return home, who might not have been able to return to their countries of origin. And we continued to serve them, even though the majority of our students, faculty, and staff weren't on campus. But fully remote is our version where we wouldn't be offering any instruction in person. And then hybrid is really what you have that's everything in between. This is where you have some people on campus, some instruction, but that our operations are more limited. This is the status that we're going to be in the fall. We're not going to look the same as we did before. There's not going to be large 100-person lectures. Instead, in the classroom environment, we're going to have social distancing. We're going to have people wearing masks on campus. It's the mode of operation that we're going to be in for a while. And we've been in that kind of hybrid mode for a while already. We began by bringing back faculty and staff to support the research function several months ago. And that was a really useful exercise because it gave us an opportunity to work through the protocols that we're using, with having people fill out forms to be able to describe their health, to be able to look at our testing, cleaning, other protocols. I'm happy to say that with over 4,000 research employees, including students who work in the labs, we know of only a handful of cases where we know of transmission in the research setting. And I think we've been able to respond effectively in each of those cases. We've also been able to bring back students like our student athletes and having them working out and being able to prepare for their upcoming athletic seasons. That's really been useful because it's been able to allow us to follow up on our testing protocols, to be able to perform contact tracing in the few cases that we've seen with the student athletes. And that we know that our operations are going to be different. We're going to have about 30% of our classes that will be offered fully remotely. We're going to be limiting events, and we're going to have few of our faculty and staff on campus. And what we're going to be doing is we're going to be monitoring the conditions. We may have periods where we pause in-person instruction for a period of time if that's necessary. And if conditions warranted, we might have to move back into that fully remote status. So the question is, how are we going to decide how to move between those conditions? And the answer itself is a little bit complicated, so I'd ask that you bear with me for a second. These aren't decisions that I would be saying I'm qualified to make on my own, or that the chancellor would be able to do without having experts to advise us. And our public health experts, our facilities experts, and our epidemiological staff have identified 11 different factors that you can see up on the screen that we're going to be continuously monitoring. Some of those factors are internal to the campus, others rely on community data, but I tend to think of them as falling into three big buckets. The first ones are external conditions, those things that are really outside of the campus and that are also outside of really the Boulder community. Those include things like the current orders from public health authorities and significantly the statewide COVID-19 effective reproduction rate. Russ Moore, who's a scientist who's way smarter than I am, can explain the math involved, but it involves an R0 formula, and that you want to keep your effective reproduction rate at a level around 1. The reproductive rate really serves as giving us insight as to what are the expected demands on the healthcare system throughout the state, and what's the disease burden in the overall Colorado community that would then give us some insight as to what we should be doing to prepare for infection within our own community. The second thing that we talk about is what I think of more as being local conditions. Those include the availability of PPE for our students, employees, especially those who are in our health and safety positions. It will include how often are we using our own campus resources for contact tracing. And it'll look at things like, what are the burdens in the local healthcare system? One of the things that Boulder County Public Health is currently doing is providing information about its hospital availability, including ICU beds and ventilators. We need to be paying attention to those as well, because we know that if there are outbreaks in our campus, those could have an impact on the availability of local healthcare resources. And we want to make sure that we're making decisions in advance based upon current knowledge of those. Beyond those local conditions, then we also have to be looking at the effectiveness of the controls that we're putting in place. And one of the things that we want to be able to do is make sure that we are reducing the number of potentially infectious contacts on campus by at least 55%. That requires us to reduce our own campus density significantly. So we're going to be monitoring campus density by hotspot utilization, wireless utilization, I should say, and allowing us to be able to assess that, be able to look at how many of our staff are returning to campus, how many of our faculty are there on a given day. We're going to be using our health questionnaire completion and what percentage of our people are reporting symptoms, so that we have the ability to have a good understanding of that. And then we're going to be looking at how many cases themselves are popping up and how many instances are we having to issue warnings or violations for violation of what our expectations are for social distancing rules, including wearing masks. Now, what that all adds up to is that we've got a lot of data that's coming into the mix. And as much as I'd like to be able to say, here's the number of cases, 12, that results in a change in status, it's not that simple. So what we're going to be doing is, because we're conducting testing much more broadly, and we're going to be doing surveillance that will allow us to both discover and respond to both asymptomatic and pre-symptomatic cases, there's a good chance that we're going to be reporting more cases than what you're currently seeing in community-based reporting. But that's actually a really good thing, because it allows us to pick up and identify people who are not currently being tested and who wouldn't be part of the results. Our positive test results are going to be higher than if we were only testing symptomatic patients, and it's actually going to demonstrate that the surveillance testing is working. Why this is really helpful is because individuals are likely at their peak infectiousness during that pre-symptomatic phase, and so identifying them early gives us a chance to break the chain of transmission, and it's likely that 20% of the students will be absolutely asymptomatic and will have the ability to identify those cases that would otherwise go undetected. We'd also view cases that are revealed through the surveillance function differently than those cases that stem from students, faculty, and staff who are reporting symptomatically. An increase of symptomatic patients also would likely produce a different burden on the healthcare system. And so what we're really looking for is not an absolute number of cases, but instead is an assessment of our capacity to respond effectively to the cases in the community and to establish the connections between those who are COVID positive and the other people who may have been exposed so that we can limit the spread of infection. That's the goal, which is to be able to effectively intervene, knowing that we're not going to have the capability to absolutely prevent. So that's how the factors play together for us to be able to think effectively about how we're going to monitor for disease presence and make shifts in our status. So Francis, can you just pop forward to our last slide? So ultimately, this health and safety measures that we're taking across the campus are varied and will hopefully provide a sound strategy for being able to return. We've modified the physical environment in our academic operations. As I said before, we're attempting to limit the number of potentially infectious contact. We're teaching in places where we never thought we'd be teaching in order to create classroom space. We're also extending the hours in which we're giving instruction to make sure that we're keeping the density down. We've ordered thousands of HEPA and MERV 13 air filters to be able to make sure that when people are in class, they will be masked, but we also want to make sure that we're providing a safe learning environment for them. We're going to be requiring face coverings. And I know that Akira and JB and Daniel will be talking to you about our code of conduct and the expectations that we have for our students and how they're going to be working with them. But we've really tried to work to make sure that we've modified our student code of conduct to reflect compliance with public health orders and training people on what their responsibilities are and having people provide daily indicators of their health status so that we have a good assessment of what's going on in our community. As I said before, we know that this will not be perfect, but we've really worked hard to be able to get to the point where keeping our students safe and healthy will also help us keep the broader community healthy and safe. And so we know that you have questions for us, but we wanted to give you this background, get you up to speed, and let you know what we've done even in the past few weeks since the last time we met.
Great, thank you, Pat. So might open it up for just some discussion before we work on anything else. And you can unmute and launch in, or we'll keep an eye out for raised hands. Or I see Mark. Mark's got a hand up. You want to go, Mark?
A couple things. First, I wanted to thank you for a very comprehensive presentation. I think it was terrific. It seems to me to be a very thoughtful program for getting students back on campus and operating. Just two questions. First, how well sourced are you for PPE in the event that the larger community is having difficulties?
We're well sourced at the moment. We have ordered 80,000 reusable masks that we'll have available on hand. We also have over 100,000 disposable masks that we've ordered. One of the things that we're also looking into, and this is more inside baseball, is some of our faculty have expressed some concern about trying to teach with a mask on. So we're also looking into the availability of those clear face shields so that they would be able to teach with those to make the instruction more personal. But so we think we've done a good job. We also have ordered sanitizer, gowns for those situations where we need it, and gloves.
Okay. My other question is the development of the saliva-based test is fantastic. When do you anticipate that might be available for the larger community?
That's something that they're currently working on. I think that will be available. They can't start producing it commercially until they get through that IRB and the state approval process. But my guess that would be, our hope is within the next few weeks.
Well, my congratulations on that. It's fantastic.
I would just add also, Mark, we've made sure that Rob Vissers at BCH is briefed on it and in contact with the commercial side of this, as well as Jeff Sayak.
Well, my congratulations. That's a great piece of work. Thank you.
Our fingers crossed. Let's see, Mary had a question.
Yeah, I just have, thank you for the presentation, first of all. I had a quick question regarding the daily health form. I'm curious about how it will be administered and what kind of data you'll keep and how you look at the data. And I'm just curious about that particular daily health form. It seems like a challenge to be able to make sure that people actually follow through with that.
You're right, it is. And currently it's a web-based form. And so I'll tell you my own personal story, which is that I live down in Highlands Ranch, so there's no worries for any of you guys at the moment, but my son, who's in high school, was recently found to have a COVID case. And so I had to go into my daily health form and would click it and say, is there anybody in your family who has been diagnosed with, or in your immediate living situation who's been diagnosed with COVID? That then gets filled out, and that would go to the chancellor as my boss, so that my boss gets a notification, we can follow up, and that actually instituted our contact tracing mechanism. Having that as a web-based form has been a little bit awkward. We're actually in the process, because we know that our students, as well as faculty and staff, and just about everybody nowadays does their life through their phones. We're very close to being able to migrate that over to an app that will be available, and that it will also allow us to be able to tie that in with our availability to monitor the campus density through hotspots. So those things will tie together to give us a better picture of what's going on in the community. So we're transitioning from a web-based form to an app in the upcoming weeks.
Thank you for that. And will the app automatically remind people on a daily basis? Get your health form done.
It will have reminders.
Thank you.
I think Junie has a question.
Can you hear me?
Yes.
Great. Thank you so much for this presentation. And I think as a student and also a city council member, it's like wearing two hats at the same time and thinking of both community members and also students, which I represent both because I also live in Boulder. I think the Chancellor Moore talked about, it's a very fine balancing act when you're thinking of promoting a vibrant student community and also protecting community members, especially during these times. And also we talked about campus density. I think for me, in your first slide, the very first slide, you talked about student government leaders engaging and messaging. And I wanted to know, what does that look like? That's the first question. And my second question is, I've received, from the moment we had this pandemic back in March, we've received a lot of phone calls from community members when it comes to the Hill. And I think the Hill will be an even more challenging time, because I think when we first, when COVID first hit, it was somehow, or at least it was closer to March. A lot of students were already leaving campus and were already going out of town. And now we're gonna have, I believe, closer to, is it about 30-something thousand students coming and going here in CU? So I think it's slightly more dynamic. Some of you know the numbers better. But what will we be doing to monitor the parties that are taking place on the Hill? And what does that look like? Because I know we're talking about ambassadors for masks. Most people have masks. I own a mask. I own more than one mask. So I think the issue will not be mask, but it will be people wearing the mask and the number of gathering that will be taking place in the community. So my question to you, do you have some type of an ambassadorship when it comes to monitoring? Because I know the police will be doing it somehow, but I think young people, most of us, we do listen to each other as opposed to older people in the community telling us what to do. So I'm wondering, what are some of the mitigating approaches that you are taking?
Love to be able to answer that question, and I'd like to actually see if Kira Bradley can jump in to be able to address that one, because I think you're absolutely right. The last thing in the world that a 19-year-old student on the Hill wants to have is me walking up as a 50-year-old guy and saying, hey, how's the party going? They're going to be more responsive to student leaders. And I think Akira and her team have been working really hard to be able to make that happen.
And in the interest of time, just to make sure we cover our agenda, maybe we should just move to that part of the agenda. Akira and her team were going to address this, as well as Maris and Doreen.
Sure. Francis, I can go ahead and move to that part of the agenda for us. So I want to provide a few brief updates around how we've been working to prepare our students for the fall. And then I'm going to ask some of our staff who work directly with the students to chime in and give you all some updates too. First, to talk about communication. We've been communicating with our students throughout the spring and the summer, our students that live on campus and off campus, regularly about expectations and how to be good peers and good community members. We're doing this not only through our CUBT, but also through social media, word of mouth, peers, our student government leaders. And before all of our students return, and you heard this from Pat, they're all required to take this COVID course. To date, we've had 23,000 students complete that COVID course, and that number continues to rise every hour. What students learn in that course is the science behind COVID-19 and how it spreads, why it's dangerous, and they also learn about the prevention strategies. This is also valuable because they learn about our expectations and our policies for them as a campus, as well as a community member. And we've done a number of updates to our student code of conduct that Daniel will talk about, and they learn about that in the course as well. And I want to briefly provide a couple of updates on housing from some questions that has come our way. We've worked really hard this year to encourage students to complete the first year housing release if they're eligible and if they're in the vulnerable population. And what this does is it helps to limit the number of first year students who would live in the Boulder community, because they will actually be living at home with their parents. In terms of the residence halls, it's also looking really favorable that we can offer housing to all students who may desire it. We're finalizing agreements with local hotels for additional residential space, where in those spaces we will have RAs. We will continue with our residential curriculum that teaches students around personal responsibility, global and community responsibility as well. We have a lot more students this year being released from their housing contract to live at home, and our wait list continues to dwindle. I know that folks have heard that we had a large wait list, and that has really dwindled down to where we're feeling pretty confident to provide housing to all students who have responded to us saying that they would like to live with us and get off the wait list. So the number of professionals that are on this call: JB Banks, our Dean of Students, Daniel Easton from Student Conduct, and then Jeff Morris will go and give a couple of updates around things that we're doing to work with the students in regards to their student behavior, as well as working with the Hill Association community. JB, you want to go ahead and get started?
Yeah, I was trying to unmute myself. I'm sorry about that. Thank you, Dr. Bradley, for certainly those remarks. And I'm telling you, we're doing a lot of work. I'm pleased to be here. My name is Jamar Banks. I go by JB, and I'm delighted to be serving in this capacity. I want to talk a little bit about my role and responsibility being on campus. I'm certainly here for a number of reasons, and I wear a lot of different hats from dealing with students in crises and all those kinds of things, but also to provide student advocacy and work in partnership with students, alumni, parents, stakeholders, colleagues, to help create a safe, welcoming environment for all students. The other thing that I've been focusing on, certainly since I've gotten here, is leading and supporting several units that encourage students to find belonging, make meaningful connections, accept ownership for their behaviors. And certainly Mr. Easton will be talking a little bit more about that in his remarks. And then finally, to develop those essential skills for life after college, which I think that Russ was talking about earlier, that once we get students here, it's our jobs to educate them in the best way that we possibly can do that. The other thing that I'll mention is, as Dean of Students, I'm working diligently within my first, I've only been here for about 2.5 weeks. It feels like a little longer, but I'm excited about it, is to work toward developing students' trust. And that means that we have to recognize the work that Junie Joseph is doing. I mean, look at what she's doing for CU. She's also representing a couple of stakeholders, constituents, and things of that nature. But these are the kinds of students who are in our communities that we're so proud of, and proud of the work that they're doing. And so we want to recognize their accomplishments by communicating and appreciating their leadership, certainly during a challenging time and situation. And so it's my role to, again, remind us of the kind of work that they have been doing. If you think about what happened in March, where we had to all quickly pivot, turn around, make some adjustments, all those kinds of things, our students were right there helping us do that, and do that hard lifting, that hard work, and moving the campus forward. The other thing that I want to mention is that our students in the community are working in restaurants, they're laborers, they're helping us in our respective businesses. In fact, I was at a restaurant just the other day, actually 2 restaurants. I've been eating out quite a bit since I moved here. Don't hold it against me. I've been eating out, and I ran into a couple of students, scholars of ours, who are doing some fantastic work, and they're learning how to be responsible in their working environment. They're learning, if you would, how to wear a mask and make sure that they're keeping restaurant folks safe, they're keeping themselves safe. And so again, building that trust is so valuable and important, and our students are doing it. They're doing it. They did it in March. Certainly we weren't perfect, but as we're thinking about returning and preparing for that return, trusting our students and what they've been able to do has been certainly helpful. And then finally, as we think about our underrepresented populations, again, what Russ mentioned is so vital and important. I was at an institution prior to being here where I work with underrepresented, minoritized, marginalized students who struggled, as we moved remotely, because they just didn't have the technology, they didn't have internet access, they didn't have any number of things. And on top of that, folks, they didn't have the food that they needed, and from a food security or insecurity perspective. So those are the kinds of things that a dean of students does, and that's what I'm hoping to continue while I'm here. As we think about a few other things, we think about our fraternity and sorority community, the work that they're doing right now. Steph Baldwin is one of our assistant directors. She's been working with our fraternities and sororities to help them prepare to come back to campus, talking about CDC guidance. Junie, you mentioned about parties. That's something that we're going to be really monitoring and paying attention to. Certainly, again, that peer-to-peer interaction, I think, is so important as we think about how we work with our students, how we educate them, how we hold them accountable. I'm living in a hotel right now, won't be as of Friday, so thank God for that. But I was walking out of the hotel, and I didn't have my mask on. I was juggling things around, and one of the folks in the hotel said, "Hey, did you know about the mandate to wear a mask?" And at that time I didn't. But once I found out to put my mask on, now I know that I'm an adult and I'm a little bit older adult and all those kinds of things. But that's the type of things that we're going to be expecting out of our students. That's the type of role that I think they'll play for us. And that's the kind of trust I think that we'll have to have in them. So as we prepare our fraternity and sorority community, we've been visiting with house directors. In fact, last night, Steph Baldwin was visiting with house directors about CDC guidance. She also was providing resources and such for them so that they can be prepared. In addition to that, our recruitment processes, for the most part, are going to be virtual. As we think about our largest community, which is our women, if you would, 2,800 women will be doing their recruitment completely virtual. And so as I think about how we're preparing, I've come across the country to this campus. I think we're as prepared as any other institution I've ever seen. I certainly appreciate the work that our chancellor, our provost, Dr. Bradley has done, because I've come to a great place at a great time. Though it is challenging, I feel like we're ready to meet the challenge. So with that, I'll pause because I'd like to have Daniel Easton, our acting director, talk about student conduct and conflict resolution as we have made some adjustments in our code.
Yeah, and I don't want to be pushy with everybody, but we are at 4:29. This is only scheduled to go till 5. So if I could ask people to sort of summarize and be brief. I know Aaron had a question previously we want to get back to. And I know Linda wanted to also talk about some of the justice reforms.
Great, thank you, JB, and thank you, Francis. I will be brief and also provide some good, hopefully some good information for folks here. So, you know, we did update the Code of Student Conduct, and I think that's been live since the end of June. And that included adding prohibitions that, one, enforce the campus policies around masking, physical distancing, things like gatherings, and also explicitly included a prohibition of violating any public health orders, which enables us to hold folks accountable and for off-campus behavior as well as on-campus behavior for violation of these provisions, because we think that we need to address those behaviors, not just if they're on our campus, but also as they're affecting the larger community. Some other things that we've been doing in order to be effective in how we hold folks accountable. One is training additional hearing officers around the Division of Student Affairs to have conduct meetings with students to accelerate the response to these reports as we get them. We want to make sure that we're responding swiftly so that we can take those steps to adjust and adjust those students' behaviors. Additionally, we've been building a more robust sanctioning model for students who are violating these policies. We'll be using sort of the impact and the frequency of the behavior. So there isn't a set, like it's this sanction for every type of violation, but rather looking at every situation individually and basing our sanctioning on the impact and the frequency of that behavior. The goal is at first is to do administrative and educational sanctions, but we will use suspension if those interventions are not effective. Our philosophy is that while they are students, we can take more educational interventions to adjust their behavior and to use suspension as a last resort if those interventions are not effective. I want to also highlight the effective partnership that we have with the Boulder Municipal Court. Linda reached out to our office in early April as this was all developing, and we collaborated and really revised our restorative justice program to specifically address the harms caused by public health order violations. And knowing that the research around restorative justice is that it is effective for altering behaviors of students in this age group, having a process for that, a restorative practice in partnership with the municipal court means that we can be more effective in educating our students and changing their behaviors as they violate these policies. And then lastly, one thing that we've also been building on is really improving and increasing the ways that we will receive information around public health order violations. So we've spoken about our partnership with Boulder Police to be provided copies of police reports and citations for us to take action, and then also improving communication with landlord and neighborhood associations and landlords themselves in order to get more information to hold folks accountable for violating these behaviors. And again, all of these things would not be effective without sort of the partnership with all of our community members here. And we're really excited that we have been able to work together to do this. A lot of this is also in partnership with a lot of the work that Jeff and off-campus housing and neighborhood relations is doing. And so I'll actually pass it to him to talk a lot about that, some of those neighborhood relationships in our ambassador program.
Thanks, Daniel. As Daniel alluded to, really what we've been doing the past few months is building and continuing to sustain relationships that we have with off-campus stakeholders. So these stakeholders are going to be actual neighbors, community members, the City of Boulder staff, as well as landlords and property managers. And what's important about this is being able to find pathways and outlets in order for CU to share information and to keep students accountable for issues that might show up on the Hill in different capacities. So what we found is through our neighborhood ambassador program, and I'm hoping this is able to answer Junie's question, is we have a peer-to-peer program out of our office where we have about a dozen student leaders that are students that live on the Hill. And what we plan for the fall is to basically take the Hill and to break it into zones where each zone is going to be responsible for 2 different neighborhood ambassadors. And what's really great about this is we've been meeting continually with the University Neighborhood Hill Association, as well as the Hill Revitalization Working Group. And these are community members, these are city staff, these are folks that live on the Hill, that have been living on the Hill for quite some time and have certainly run into some challenges and are looking for us to kind of find some solutions to those challenges. So through this program and continuous meetings with neighborhood associations, we've really been able to develop a collaboration where each of these neighborhood ambassadors is actually going to be able to be partnered up with what UNA, the University Hill Association, is calling block captains. So now that we have these zones broken up on the Hill, there are going to be specific zones that are actually related to neighbors that live in those zones, as well as students that live in those zones. And so these folks are going to be more or less liaisons, partners, representatives of CU, but also representatives of the neighborhood. And I think that's the most important piece here, is that we have representation from both the institution, but also the neighborhoods and the communities that these students and permanent residents do reside. When it comes to these partnerships, we hear almost every week from UNA, and we are super grateful for this line of communication that has opened up. It has created a system for us to be able to know what is going on the Hill at all times. We are not naive to think that sometimes BPD is extremely busy and might not be able to answer a noise complaint or a nuisance violation that a neighbor has called in. And so what these block captains and these neighborhood ambassadors are able to do is to have these conversations peer-to-peer with these students when we receive a complaint from a neighborhood. What's also beneficial about this kind of system is that on a weekly basis, we meet with representatives from the Boulder Area Rental Housing Association, which is a group that represents the majority of property management companies and landlords in the city of Boulder, bringing in the conversation for landlords, property managers, and using these stakeholders in order to assist us with keeping students accountable that may be misbehaving on the Hill has really drastically changed a lot of the culture. So now when a CU student is having a complaint, we hear a complaint at the school, and then we actually are sending a letter not only to the address of that complaint, so the student is aware that CU is aware of such a violation, but the landlord is also getting that same letter as well, saying, we want to let you know that your tenant at this address has received a complaint. If they receive a second complaint, we will be requesting your student tenant names. And at that point, like Daniel had mentioned, as far as our conduct and our adjudication processes go, we do need a lot of evidence, and we do need a lot of information in order for that formal process to take hold. So when we are contacting the landlords, what we're finding is that the students are, let's say, fearing the landlords more than they are CU when it comes to getting in trouble. So when the landlords are finally making those phone calls to their student tenants, they're also making these phone calls to those student tenants' parents, because those parents tend to be the co-signers that are on the lease, and the landlords have that legal liability to do so. So what we've seen in the past few weeks, because this is a fairly new process for us, is that this is starting to work. We're starting to see houses that normally receive complaints not receive complaints after follow-ups with neighbors. It's really been our goal the past 3 months to create these communication lines and to create these partnerships with the neighborhood stakeholders, with the property management stakeholders, in order to get information to our students, have conversations with our students, but also be able to utilize and to be able to see what is actually happening on the Hill. We want to be current and we want to be intentional. And the only way that we're going to do that is through partnerships with the University Hill Association, with Barha, and with the City of Boulder through these Hill Reinvestment Working Group. One important piece that we plan to do before we go into the fall is sharing what we're calling an informational landlord packet with all of the landlords and property managers before the students are moving in. This packet is going to have a lot of information in it on how landlords can utilize CU as a resource. With the recent amendment to the nuisance abatement process in Boulder, many property managers are extremely fearful for their property losing their rental license, their students getting evicted, and so they are reaching out to us to ask questions on how do I do this, what can I do, what types of resources can CU offer to make sure that my tenants are behaving and contributing behaviors that are appropriate for being a community member. So these conversations continue. These packets for landlords will also have information on student responsibility, student accountability, as well as COVID guidelines and guidelines for students on what we are calling a COVID roommate agreement. So basically documents that students can be prepared for a potential outbreak, if they need to isolate, if they need to quarantine, what are those next steps for our off-campus students as they are off-campus student tenants, and we are recognizing them as that sense right now.
So I'm going to jump in here, Jeff. I apologize,
yeah.
But we're down to 20 minutes about, and I'm afraid that we're not leaving enough time for all of our various speakers and some Q&A. So I know that Linda Cook wanted to address some of this as well, and a chance for our police chiefs, but we also have an update on CU South. We have questions. So if I could ask people to be brief, and then let's move back to those questions, and Aaron's at the top of the list. So Linda, you want to take it from here?
I'm happy to go next. I noticed that the police chiefs were ahead of me. Did you want them to speak at this
Well,
point?
I only brought it up because Daniel raised this and to stay in context with what he had said.
Sure. Okay, so a couple of things I'd like to highlight. First of all, something that we've been doing every year for years, we will continue to do this year, which is to fast track cases. So people who get violations, CU students who get violations, are seen in court no later than 12 days after the date of their violation, and the average is more like 6 or 7 days later. And we hold court twice a week for these types of cases. Normally it's once a week, but the entire month of September we hold court twice a week. So there's a swift response to their citation. Secondly, all of the information sharing that you just heard Jeff described that they're doing with landlords when there are complaints, that's something we've been doing with the landlord community when there have been citations. So we've had that leverage for a long time. I'm glad to hear that it's going further upstream and it will start happening with complaints, because getting the landlords and the parents involved is really helpful. One of the things we've added this year is that I reached out to IFC on the Hill, and we've had a couple of meetings now, and they are now also going to be a recipient of that list of violations that we send out. So, so there's an additional point of leverage that we haven't had before to deal with violations that occur at Greek houses. And you may know that they have a social moratorium in place, but we also know that violations occur at among Greeks at other rental houses in the community. Interestingly, they also have an IFC judicial board, so that line of communication that we've opened up with them will allow them to use that as a sanction as well if there are violations involving the Greek community. I'm going to skip over one thing that I wanted to comment, or one thing that I was going to mention, but I do want to comment that in terms of the sanctions, CU restorative justice is one of the things that we have used heavily over the years because of it's really better at prompting behavioral change than just about anything else that you could use, like high fines or lots of community service. When I reached out to the folks over at Student Conduct and CURJ and asked them to develop a COVID related model, I just want to say that they delivered in spades. A week later, I had an email with 3 different models that they had designed for this purpose. So they can take a very nuanced approach. And so we're really thrilled that we've had that in place, and we've been using that even for the violations that occurred last March when we started seeing those folks back in court again in May. And so I feel really good about what we've developed. Of course, restorative justice isn't the only sanction that we have at our toolbox, but the community living class, which is taught by the Office of Off-Campus Housing Neighborhood Relations, still remains one of those. Substance use treatment through health promotions. And then one of the other things that we've added in most of these cases is having students write a reflective essay regarding COVID, and we've given them prompts so that they are really thinking about the impacts of their behavior on others, as well as additional community service, which we outsource again through CU's Office of or Volunteer Resource Center.
Thank you. So just keeping us moving along, we have a number of people who have a hard stop at 5 o'clock. We can offer to those of us who can remain, could continue to talk. If I could ask both the police chiefs to give a quick update, we could have some Q&A and then move to our other topics. Does that sound reasonable?
Perfect. Thank you, Francis. I'm actually going to turn it over to Chief Harold. It's probably good that both of us speak fast. She's been working on some great initiatives over there at the police department, and we've been collaborating a lot. So we're glad we're able to share those things. So Chief Harold, please go ahead.
Thanks, Chief. Francis, I'll be brief. I have 8 talking points. I think the most important one is that Doreen and I have been working together for the last 3 months since I've been here. She is a great partner. Our perspectives on safety and policing are very similar. And with that in mind, Boulder and CU Police will continue to take a posture of education, warning, and citation arrests in egregious cases. However, if large crowds gather, Boulder Police Department will respond, investigate, document the behavior with body-worn camera footage, cite and arrest responsible parties, and collaborate with the city's legal team for possible chronic nuisance abatement issues. We talked a lot about the paperwork. That has all been ironed out. We are all receiving data from each respective agencies. Boulder Police Department with CU have assigned commanders respectively for this project. They will work together for the next semester. They have had ongoing dialogue on a daily basis of issues of noise, litter, public health ordinance, business violation, as well as crime on or near the university. Doreen and I will continue to meet on a weekly basis. Starting August 15th, Boulder PD will put out extra patrols, 8 or 9 additional officers to work the university setting, Thursday through Saturday, 12-hour shifts. They will help with traffic, visibility, citations, and arrest if necessary. I'm awaiting on data points to ensure proper deployment strategy and hours of utilization. On Monday, Boulder PD will have a new analyst start. I'm very excited about this. We will provide the CU chief with a crime and disorder report on a daily basis. And so the project commanders and the chief understand trends and patterns and series of disorder and crime. The chief and I will continue with our meetings with Hill residents, and we have another one scheduled at the end of August to see success. And we will continue to reduce issues associated with CU students, specifically noise and public health violations and litter. And then lastly, we will continue to have ongoing conversations with the city's legal team, specifically Tom Carr, on addressing absentee and poor place management issues as it relates to repeat calls for service. And I'll be glad to answer any questions. Chief, do you have anything further to add?
Thank you very much for that. We really appreciate it. And as you guys can see, we have done a lot of collaboration between both police departments. And we do have the posture of education, and obviously through Dr. Bradley's leadership through student affairs, they have built out some really robust systems for us to utilize. We are looking at different patrol shifts and deployment plans as it relates to the coming back to campus. We are looking at special duty details and what that looks like. And obviously Chief Harold went into that. And obviously between both police departments, we do have the ability to pivot and be flexible, that as this unfolds and goes, we will look at those trends and see what's exactly happening so that we can adjust our posture as needed and move forward. And then I would just like to offer up, and I speak on behalf of Chief Harold, that we're both willing to have feedback, suggestions. If you're hearing different things, please feel free to let us know. You have our contact information, so please feel free to reach out so that we can take those data points back and we can look at it and reassess the things as they unfold. So thank you very much. And I turn it back over to you, Francis.
Thank you. You guys were speedy. Thank you very much. So I'd like to just go back. Aaron, I know you have a hard stop at 5. Did you want to ask your question?
Oh, just real quickly, what the testing capacity that you're anticipating for the new saliva tests, which are very exciting, by the way.
Pat, do you want to take that one?
Sure. We don't have the exact numbers yet. So we're building it up. We know that we're going to have at least 7,000 to 9,000 of them to be able to run during that initial move-in week. And then we think that we're going to be able to scale up, hopefully to the point where we'll be able to run, I believe, Dan, is it around 10,000 a month?
That's correct.
A month or a week?
Sorry. Yeah, so between all of the different tests that we're looking at, it's per week.
Those are some big numbers. That's great.
Great. I don't see any other raised hands at the moment, so perhaps we should shift to the South Boulder Creek update.
Yeah, let me just kick that off by number one, apologizing that I forgot to introduce Joanna Bloom. I'm so sorry, Joanna, who is with our utilities department, and she is here to give a really quick update about where we are with South Boulder Creek. Joanna.
Thanks, Jane, and no worries at all. You did beautifully. So I am Joanna Bloom. I am the Utilities Business Relations Manager, and just wanted to give you a quick update that on June 16th, Boulder City Council did provide direction and chose South Boulder Creek Flood Design Project that would protect a portion of the city from a 100-year flood event. This design uses 80 acres that the city has dedicated, or I'm sorry, that CU has dedicated to the city for use for flood protection. Since the June decision, the engineering design work has begun and the process has shifted from more of an external engagement focus to an internal flood design focus. Staff is also in the process of following up on a second portion of Council's motion, which was aimed at closing the loop on questions related to what is being called an upstream option. This approach would potentially use the south end of CU South property. And we're not quite sure what will come out of that process yet, but we'll definitely circle back with any updates. And then related to annexation, which is related to the flood design project, CU and city staff continue to work together and meet on fleshing out and annexation details. And we look forward to continuing our partnership and really want to thank Francis and Derek and Kim in particular for their continued efforts. And we'll give updates to this group as needed. And that's what I had.
Great, thank you. Any questions about that? Good, so we were asked to give an update on the conference center, and Derek Silva has joined us to be able to do that. So, we'll turn it over to him.
Hello, everyone. I'd just like to say that this topic really does pale in comparison to what we've been talking about, but it is almost a 2-decade project in the path to realization here. And it's still alive and kicking despite the pandemic's hospitality industry, and is making slow but sustained momentum. The pandemic obviously has hit the hospitality industry very hard. The projection for 2020, occupancy for the hotel industry is about 38%, which CBRE anticipates will be the worst year on record. That said, we're making progress. Prior to COVID in November of 2019, the Regents approved the campus to move forward with the ground lease. And then since then, we've been making headway on the ground lease agreement and other agreements that will effectuate this transaction. The plans have advanced to a concept design at this point, and we anticipate right now, and I have a lot of asterisks after this date, next summer groundbreaking with an estimated delivery in mid-2023. And I'm happy to take any questions on that.
Well, good. I rushed everybody along and now we got 8 minutes to talk. So I'm hoping that there are some questions out there. One clarification I will make on Joanna's comment is the university has offered 80 acres to the city as part of its annexation application. That hasn't been completed yet. Questions, things on the Hill, testing. Oh, Mark, yes, sir. You're muted still.
I apologize. Question for Derek. Have there been any changes in the availability of financing for hotels at this point?
It seems that projects right now are still able to attract financing, at least strong projects, which every indication from the groups we've been talking to indicate that this is one of the strongest projects and the most attractive projects in the country. That was both before COVID and still after COVID. What we're seeing is the terms aren't near as beneficial as they were before. we're seeing construction loan to costs around 50% at about 5% rates. So obviously that's higher than what we've been used to. And so I think that's where the risk is being priced in. It's not so much, certainly availability for many projects would be curtailed, but for projects like this, they're still able to get financing just at less advantageous rates.
Thanks, appreciate it.
Rachel.
Hi, Francis. Hi, everybody. I guess I was wondering if anybody could go into a little bit more detail on where we are with annexation discussions on CU South, or any more updates from the university side, or while we're all together, any reds we can go over or understand better. I don't think I have a real good understanding of the timeline for annexation, or even like an end date that we're shooting for to have that completed. So I'd be curious if there's any information out there.
I can jump in briefly on that, and that is that, as Joanna mentioned, we're actually meeting, I think, next week with Phil and Joe and team to map out that schedule and what it could look like, and how we march through the key elements, you know, because a lot of the annexation elements have been laid out already, and we've dealt with the preponderance of them. We're down to the probably, you know, 5 to 10 gnarly issues. So I think we're going to work through those systematically with staff and bring them back to you all so that we can put that on a schedule to advance it. But that schedule we'll work on next week and then be back in touch.
And Phil Kleisler is here on behalf of the city. Phil, do you have anything to add?
No, that was a great summary, Francis. And I guess I'd echo Joanna's comments about working with the university. For those not super familiar with that project, we worked really hard together and partnered with the university and the community to adopt what was called the guiding principles for this site. And we actually adopted that into the city's comprehensive plan. And so that's what's kind of guiding these discussions. And so the flood mitigation project that Joanna mentioned that was approved last month was a big milestone. And now we're kind of turning our attention to a lot of the other big issues that have a lot of council, CU, and community interest, like transportation, future recreational opportunities, and so on.
Thanks, Phil. And do we have is there a target date for when that will come back to council, annexation, like timeline or update?
Yep, we will be bringing a draft proposal for we have a CU South process committee meeting with Mayor Weaver and council member Friend. We will be discussing that in August, at your August meeting. And our goal is to come back in the fall. We were looking at a November, December, hopefully with a bit of information for you. But we're still fleshing out some of the details, which are dependent on consultant work and so on.
Okay, thanks.
Adam's got a question.
Yeah, thanks, Francis. I haven't seen very many updates from CU Athletics as far as what's been ruled in or ruled out at this point. Do you have any further information about that, since that's coming up pretty quick?
Chancellor, you want to take that one?
So let me try to respond to that. What we know of today, and actually tomorrow, is a Pac-12 meeting with the presidents and chancellors to talk about fall athletics and fall sports. Right now, the presidents and chancellors of the Pac-12 agreed to a schedule of just conference games, no conference games. So we're looking at either 9 or 10 conference games in the fall. The idea is starting maybe somewhere between September 19th or September 27th for the first game, and have more than one bye throughout the season so that student athletes will have an opportunity, if they do get ill, to quarantine. And so that's the plan for right now. There's no plan at this time about individuals being able to watch the game, watch football in the stadium, in our stadium or any stadiums. And that really will depend upon our county, the governor, and others about having larger crowds. So we are planning for football in the fall, as well as other fall sports. Right now with football, either a 9 or 10 game season, that will be conference only, because that way we can control the testing of student athletes, because all of us in the Pac-12 conference will have the same testing procedures. So that's the most we know of now, and I believe we'll hear more within the next couple of weeks.
Thank you, Chancellor.
So I'm jumping back in for one of the perils of Zoom technology is that you can get kicked out. And Frances, as our facilitator and host for the event, got kicked out of her own party. So I think if there's any more questions, we'd be happy to follow up on them. But otherwise, really just wanted to take the opportunity to thank you for letting us come and talk to you. And I know we had a lot of people, and I'm most of all guilty of it, who gave you an awful lot of information in a very short time. But we've been working hard to try to make sure that we are providing you with up-to-date information and that we're doing the best things for both the campus and the community, and really appreciate it. Phil, any wrap-up?
Pat, if I may, before we leave, I just want to, of course, Jane, with your announcement of your upcoming retirement, it seems that this may be, your last CU City Leadership meeting. And I just want to say on behalf of the university, thank you for the partnership over the last 12 years and the excellent leadership you provided to our city. You certainly will be missed, but I hope you really enjoy a well-deserved retirement. So Jane, thank you for this wonderful partnership that we've had.
Thanks, Phil. And what the rest of you don't know is that Phil already wrote this to me, and I wrote back, "Takes two to tango." So we definitely have had a great partnership, and I appreciate, Phil, your leadership and just all of the folks that work with you on your, I call it leadership team. I know you guys have a different name, but we have really appreciated working with all of you. And I think that the City of Boulder and the University of Colorado Boulder have among the best working relationships in a town-gown way that as any city, any university in the nation. So thanks to you and your team for that as well.
Great. Well, thank you very much, Jane. And thank you to all. And I want to thank all the community members who Zoomed in, and we look forward to continuing these conversations, not only about COVID, the opening of campus, but as we move forward with annexation, with the conference center, and other exciting things that we'll be doing with the city. So thank you all so much. Be safe, stay healthy, and go Buffs. Take care.
Thank you.
Thank you.
Bye.
This meeting is now ending. Thank you for attending.